Okay, it switched over right at 12 o'clock. We'll go ahead and get started. I'm going to stop sharing this screen here. So you all should see me here. You can see all of our faces now. Okay, everyone, welcome back to another Health Talk in our Health Talk series. I'm excited for this talk. I love nutrition. We are talking about diabetes, though, but we've got April here, who is our dietitian at Watauga Medical Center. She is the clinical director of our other dietitians as well in our dietitian nutrition management department. And then we also have Dana Brackney, and she's from App State. But both of these ladies here are part of our local diabetes program that we have here at the hospital. And they take great care of our patients in our community and those that have just been recently diagnosed with type 2 diabetes. Anyway, I'm going to let them talk a little bit about themselves just so you can get to know them and their backgrounds. And then we're going to hop into asking some questions. This health talk will look a little bit different. Dana both agreed that they did not want a PowerPoint. They wanted this to feel very conversational, and they wanted you all to come with questions. And we're just going to have a discussion around diabetes and answer some of the hard questions. There, maybe you have a family member that has diabetes and you haven't asked this question to your provider and you want to know the answer. These ladies are here to give you all the details. And I will be here along for the journey. And I have, as always, I've got my questions printed out here for you. But anyone listening, please just go ahead and start putting questions in the chat and we can go from there. But first, we're going to start with introductions. So April, let's start with you. Let's tell me a little bit about your background and what you do here at the hospital and your role within our diabetes program.
Okay, sure. I am a registered dietitian and a licensed dietitian nutritionist. I got my master's degree from ASU back in 1995 and became a dietitian shortly thereafter, and actually did my internship here at Watauga Medical Center and have spent my career here with the opportunity to do lots of different things. That's what makes a small rural hospital that has its fingers in several areas serving our community so neat. I've never gotten bored with my job. I've gotten to work with dialysis patients years ago, medical oncology, employee health, inpatients, outpatients. I still do a lot of outpatient work. And diabetes is just one of the things that I have a specific interest in. I truly enjoy helping patients deal with that and help them live with diabetes more effectively. So, yeah, that's pretty much. I've been hanging out here for about 30 years and still love nutrition and love helping people and like to help just make things easier.
Well, thank you, April. Nutrition's so interesting because it's always evolving. And I'm
Yes.
sure everyone on this call can agree. One day eggs are bad for you. One day eggs are great for you. One day you should be doing this and one day you should be doing that. And it's crazy. And there's still so much to learn in the nutrition science world.
Absolutely. It changes all the time, but there are some guiding principles that have been there since I started my career and probably even years before that. So I think we can always go back to the basics and then kind of tweak with what we're learning from new research. So that's something I really love to do. I love to learn new stuff, but it does change a lot and it is hard to keep up sometimes.
Well, thank you, April. Dana, do you want to introduce yourself and your background and how you got into this field of being a diabetes educator?
Sure. Thanks, Maddie. I am an RN. So I've been an RN for almost 40 years, and I've worked with people who live with diabetes for about 35 years of that as an advanced practice nurse. So currently, I am a professor of nursing at App State, and I teach in all of our programs right now, primarily with graduate students, because I do love research. So I'm really glad, Maddie, that you brought that up about how recommendations change. And yet how April said, you stick to the basics. And sometimes the perceptions about things being bad or good come more from the news media than from research. So they're trying to get eyes on their article. So they'll say something kind of inflammatory or to get you thinking, so that's why it's so nice to have someone like April who understands the research, behind the things and why it's so important to work with people who are credentialed in the area. And I'm credentialed as both a diabetes care and education specialist and as an advanced diabetes manager. And I'm in the clinic at the Broy Health Center. We call it the diabetes clinic, but it's really, it's really, I can't think of it right now, the Living Well with Diabetes kind of clinic. And
Yeah.
it runs on Thursday afternoon. So I've got my clinical outfit on today because
Oh,
I'm in my upstate office. But because today's the day I get to work with people who live with diabetes, and I see people who live with diabetes making excellent choices, great changes for their health all the time. I have loved my career. I love doing it so much that even though I have a full-time job at App, I just have to stay in clinical practice because
well, we
I love
appreciate you. We appreciate that. When you say the Broy Hill Wellness Center, you are referring to the Wellness Center, which also shares an office with App Ortho, correct?
correct.
Okay.
So that's where
So I
all
just wanted to
this
clarify
is
that
at.
for
And
listeners.
it's very confusing to folks to find where it is. We do our best to communicate that. Don't worry, we'll find you if you can't find us and get you there.
Great. Okay, so thank you for introducing yourselves. We'll go ahead and get started. Like I mentioned earlier, for those that have newly hopped on, this health talk is a little bit different. We do not have a presentation, and we wanted this to be conversational and for you all listening to put your questions in the chat. And you've got April and Dana here that are happy to answer any questions that you have. And please don't be shy, put whatever you would like to in there, or even if you have a comment about something, please do not hesitate to put it in the chat. I will be monitoring the chat, but I wanted to just get us started. A fun little icebreaker question is, what would you tell someone? What's one piece, I know it's going to be hard, but what's one thing you would tell a patient that was recently diagnosed with type 2 diabetes? Or maybe it can be, what's the first thing you would tell them? The best thing, the first thing, the best piece of advice. I'll let you roll with it. April, I'm going to let you go first.
What I would say is this is a very manageable disease. Most people are able to, work with their providers. And I do want to recommend, that when you have that diagnosis, that you reach out to people who can help you, like Dana. I mean, look how much experience she's got in just helping people navigate those medical issues that come up and medication issues that come up. I help people navigate the nutrition portion of that and help them realize you don't have to give up everything you love in order to manage your diabetes. We work a lot with people on just getting a good, well-balanced diet that has an appropriate amount of each of the macronutrients, the carbohydrates, protein, and fat, and all the other things that we can use to kind of make the diet healthier. There's even the possibility that someone might become healthier overall because they're paying more attention to their health, and being more mindful about what they're eating. But diabetes is a very kind of overwhelming disease in a way when people are first diagnosed, especially because there are so many myths out there. There's so much misinformation, and sometimes it just helps to work with somebody that can get you on track, help you see what's really important, and focus on the things that are really important. For me, it's going to be saying, look, we can work with your lifestyle. We can help you figure out how to enjoy your favorite foods, but at the same time, how to make sure you're getting a well-balanced diet that is supporting your efforts to control your glucose rather than sabotaging them in a way.
Yeah.
So
Yeah.
that's what I think about. And two, I think it's also important to keep in mind that not only is diabetes a medical issue, but it can also be an emotional, a psychological, a neurological. It comes with all those aspects. And so we want to think about the person as a whole and get in there and help them get on track with what's going to really make their life better. And so that's what I like to do. A lot of it's reassuring someone that, we can deal with this.
Right.
It may take time and it may take a lot of resources, but it can be done. And there's support out there.
Yeah. What a beautiful thing to have you both and have that support. I know we've done previous health talks before. We've done health talks on Parkinson's and other things. And sometimes it is hard just to get a diagnosis of type 2 diabetes, or like I said, when we've done health talks on Parkinson's. So it's always just good to know you've got people here in your corner. You all are right here and ready to help and to walk people through this journey. But Dana, do you have anything you want to add to that of what's the one thing that
Yes.
you would want people to know after they've just been recently diagnosed?
Yes, thanks, Maddie. I loved all the things. I say yes to everything April said, and probably something that comes more from a nursing perspective. So, in addition to recognizing, some people feel very panicked initially, like because they feel like, oh, like it was their fault. And so, one of the first things I want people to know is that diabetes doesn't have a single cause. It has multiple causes that contribute to it. And so some of the very first thing I help people understand based on listening to them and getting to know them is what maybe were primary contributors to that, because it's often not the thing that people think it is. They think, oh, this is why this happened to me. And
Yeah.
and I listen to that. I mean, that could be a valid thing, but because of my experience, we'll focus on there's many causes. So that's one thing. And the second thing is, let's start monitoring, either using finger sticks or using a continuous glucose monitor so that the person can really know their diabetes and can
Right.
really see what are these foods, what is this activity, what's happening with you. And so
Right.
that's where I like to begin.
Yeah. Well, great. Thank you. So our chat has been awfully quiet. I guess everyone is shy today, which I don't want people to feel shy at all. Please ask your questions. If you have any questions for April or Dana, please put them in the chat. But like I told you all, I have questions that I want to know the answers to. So I'm going to keep going down my list of questions. And I'm going to jump right into talking about GLP-1s. Am I saying that correctly?
Yes.
I know other people on this call too. We have seen the commercials about how GLP-1s can help with diabetes or type 2 diabetes. I want to know the scoop. How does this really impact health? How does this impact your diabetes? Do a lot of your patients do these types of and weight loss injections? Just give me the scoop. So
Yes.
April, I'm going to let you go first. Is this something that you support or find helpful when you're helping someone with type 2 diabetes?
Mhm. Uh, yes. Now, of course, my part of it is not as much with the medications, but I do work with people who are on the medications, and they certainly can be a helpful tool. I think that they need to be approached in a very realistic manner, in terms of realizing they're not a magic bullet any more than the other medications we've had in the past, although these are especially effective. They do help bring glucose down. They do help with weight management. A lot of research is being done to see how cardiovascular disease and even Alzheimer's may be affected by GLP-1s. Some of the things that I'm hearing right now are very positive about that, but they do carry risks, and Dana may be able to talk a little more about, just how they act and how they're utilized. But I am certainly not against them. I just think people need to be realistic. The biggest thing I see, from a nutrition standpoint, is sometimes people think that any weight loss is good weight loss. They don't think about how we still need to be very careful about nutrition. We still need to be active. We still need to make sure we're sleeping well and that we are managing stress, because all those things affect our overall health. So, from a nutrition standpoint, I think it's good if someone is on a GLP-1, they need to be referred. Of course, I'm biased because I'm a dietitian, but I do feel like it's especially important for them to be referred to someone that can help them make sure their diet's well balanced, because it's so easy they affect your appetite. I mean, they act at several different levels: the brain, the gut, digestion, all of that is going to be affected by GLP-1. And so it can really affect what your choices are. And
Yeah.
it's important that you're still aware of eating a well-balanced diet, because sometimes you may not feel like it. If someone's not on that medication, we really work on trying to help them tune into their hunger and fullness signals, and being aware of, paying attention to when they are starting to feel full. Well, with these medications, some of that kind of gets turned upside down. You can't always depend on appetite to tell you when to eat. So
Yeah.
something I really try to work with patients on is making sure that they understand they still need a well-balanced diet. And then the other thing is, once, we're seeing more and more, and more research is being done on this, but of course, they're only effective for as long as you're on them. So it's not like an easy fix. I'll go on this, and then when my weight comes down, and which can help certainly with blood sugar, but especially if someone's taking them to help with weight management, just because you reach your goal doesn't mean you just stop the medicine, because what the medicine was doing to help, all the issues that were there before will come back. So I just like to make sure people understand, now if you've made really good strides in improving your habits and that sort of thing, you certainly are more likely to be able to at least go on a lower dose, or maybe you could go off and see how you do and then come back. But overall, I think what I have seen happen is, if people go off of them, then, the issues come back. So I want people to be realistic about it, in other words, when they go on those. But yeah, but from a nutrition standpoint, the main thing is making sure they know what they need, and that they're making an effort to get that in.
Well, April, you've convinced me that if I ever need to go on them, I want you in my corner. And it just seems like everyone should be sitting down with a dietitian and learning this information. And you're right, it's very interesting. There's so many, I love nutrition, and I've learned a lot about like hunger and fullness cues, and how, in today's society, sometimes those get messed up. Or even growing up, some parents are like, you need to clean your plate and that kind of thing. I don't want to get too sidetracked there, but it's just, it's interesting to think about with these injections or weight loss injections, that it can impact if you're hungry, or I don't know. It's just interesting. Always good to have you, and it benefits everyone to be able to talk to a dietitian. Dana, do you have anything you want to add about
Well,
GLP-1s?
one thing I'd like to add is that GLP-1s are a hormone. And so some of the reasons why people have problems with obesity, I'm talking about a BMI over 30, let's say, which qualifies you generally for considering a GLP-1, is because you have a hormone deficit. Like if we think about the thyroid, people take thyroid because their thyroid isn't working appropriately. Well, the GLP-1, some of these hormones that help regulate appetite and hunger, insulin release, glucagon suppression, all of these are actually not functioning correctly with this. And that's why a person benefits from taking it. So I think it's a mindset. It's not like, I don't know, it's not like you're doing something super artificial to yourself, if you know what I mean. It's like a replacement hormone for something that isn't working. But that's why working with April is so important, because what we see is people also lose muscle mass on these medications. And that's why eating appropriately, and many people, I feel like, because of of the weight gain that they've had, they tend to not eat enough or eat strangely, and an unbalanced kind of meal pattern. And so those habits really do need to change, even though the person's losing weight.
Yeah.
And they have found, at first they were very concerned with the muscle loss, But what they found is, depending on how much obesity you have, the amount of fat stores actually were inhibiting the muscles from moving, because they so much of the adipose, the fat tissue on the muscle. So even though the muscles were wasting, it was still a health benefit to having less muscle mass, but anyway, it's complicated. All that to say, there are very side effects, and it's complicated.
Yeah. We've got some questions in the chat, which I
Yes.
love. So there's one question that's on this same topic here. Someone said, I have a family member who has recently started on Ozempic and is experiencing negative side effects. What are the pros and cons of Ozempic versus other options like insulin? Dana, do you want to go first this time?
Sure. One advantage is Ozempic, it can be one injection a week. Insulin involves daily and often multiple injections a day. So that obviously is a concern. Ozempic, because of the way it works with its checks and balances, usually doesn't cause low blood glucose, but taking too much insulin, you could have problems with low blood sugar. Also, we call that hypoglycemia, but low blood sugar. And so, and then, so that's the main. Insulin is also, you're not likely to lose any weight taking insulin. With insulin alone, you're likely to gain weight, which continues to be a problem with your diabetes, because often type 2 diabetes, the strong part of that is insulin resistance. So you likely would have to take much more insulin than your body needs to get the effect.
Right.
Because of you have to like overpower that system with more insulin to get it to lower your blood glucose. So I'm sorry to hear they're experiencing negative side effects of the Ozempic, because nausea, vomiting, those kinds of issues, diarrhea, are the common side effects to the Ozempic meds or to the GLP-1 medications. So sometimes if you can adapt to that, but sometimes you cannot. So.
Yeah. And now, if this family member, if they are experiencing these negative side effects, do they go back to their primary care provider and share that?
Yes,
Okay.
of course, because and it's very important to always report to your primary care physician what you are and aren't taking, because often it's the difference between having medicines prescribed and medicines you're taking. So it's really important to get those removed from your profile if you're not taking them. Otherwise, people can make poor clinical decisions without understanding that. So it's so important to tell your physician how you're taking, because some people, myself included, I'm not a perfect medicine taker, and you end up like, oh, I'm not really taking that every day. And what does that mean? So it's really important to be honest with your healthcare provider are people too. We know that, that these things are not perfectly done, but in order for us to help you the best, we need to know what imperfect way you're doing this.
Right. Right. April, is there anything you wanted to add about Ozempic versus insulin, or did Dana?
No, I mean, I totally agree with Dana on what she mentioned. One thing I will mention about the side effects, I was listening to some research last week, and they were talking about how for some patients, they're finding that if they will titrate the dose down some and not increase it, and give people a little more time to adjust to the side effects, that they have seen an improvement in adherence rate over, like, compared from so many months, that people tend to stay with the medication. Because right now, if people give up too soon, there is a pretty high rate of not taking the medication, as Dana said, or it just not being able to do its job. I mean, if you can't take it, it's not going to do its job. But So that might be an option to talk to your provider
Yes,
about. Could we back the dose back down? And,
yes,
and
definitely,
yeah, so that might.
definitely. Yeah, thanks, April. Yes, we have seen that where you just usually they titrate it up to a dose, but
Mhm.
if they're not if they haven't even tolerated at the lowest dose, you know, there's nowhere to go. But if they were doing okay and as they advanced it, they got the more side effects, just back it down to the dose that can be tolerated.
Yeah. Well, thank you, ladies.
Yeah,
You've got multiple questions here in the chat, and
that's
I want to be
great.
able to get to them all. And bear with me. I'm going to read this one, and it's a little bit long. And Dr. Trey, I'm so sorry if I mess something up here, but I'm going to try reading the whole thing. Okay. I have been reading about how reducing dietary fat intake, particularly saturated and trans fats, improves insulin sensitivity and decreases insulin resistance. This effect seems to be most pronounced in the context of low fat, plant based diet, which has been shown to reduce body weight, decrease ectopic lipid accumulation in muscle and liver, and enhance insulin sensitivity. When a patient is either pre-diabetes or diabetic, do you discuss with them that is an option in addition to their other usual recommendations? Did you all get all of that?
I did, and
Okay.
I can see it.
Okay. Dana, you're like raising the
I'm
roof.
like,
So
yeah.
go ahead.
Well, and I'm sorry, April, but
No, go
um,
ahead.
I I very much encourage people if they, not everyone is ready for that kind of change, but there's lots of evidence of the benefits of a plant-based diet. And so we'll talk about maybe trying, if they can go with a plant-based day or two or start, so on most people for change, well, there's two kind of people. Some people, stop things and change immediately everything. They're all or none people. And I've seen that. I'm not an all or none person, so I don't know how to do that, but I have seen people do it. But most people, it's what I call incremental change. So they try things. So yes, there are benefits to this, is the bottom line. And yes, we discussed the options of plant-based nutrition. I very much am a proponent if someone's willing to. In the end, I'm a proponent for the person in front of me, but do I love a plant-based nutrition? Yes. Do I live it? Yes, but not perfectly, and so I'm a big fan anyway.
Mhm. I've been vegetarian for maybe 7 years now, my husband and I both, but it's really helped us to be creative with food. I never thought all the little things that we could do with being vegetarian, and it's really
Yes.
fun. It makes you enjoy food again, though. You get to learn so much about different plants and vegetables and how they all come together.
Mhm.
Okay, April, do you want to add anything to that? Talking about a plant-based diet.
I mean, I certainly think there are benefits of following a primarily plant-based diet. I am not opposed to someone including animal-based products in their diet, especially some research has suggested that when you get a good source of animal protein, low fat, or lean in the morning, that is really helpful for building muscle and muscle recovery during the night. That's one area that I have looked at.
Interesting.
And the reason that the animal-based protein can be a advantage then is because the amino acid profile. It's a little bit more, varied, but especially leucine is one of the amino acids that helps trigger muscle building. And there seems to be kind of a window in the morning, according to the research that I have followed, that can be especially good for maintaining muscle mass. However, there is a lot of research that supports that having a lot of plant-based protein throughout the day and incorporating more plant-based meals in your daily intake is really helpful. And certainly, I'm all about eliminating trans fat from the diet, and really, I encourage my patients to limit saturated fat. I'm not convinced that that's, you're going to see controversy though out in the media, and you'll, as Dana mentioned earlier, you may see one research study come out with this really eye-catching headline, like saturated fat doesn't cause heart disease or something like that, or whatever. And you really got to delve into it and look at, what context is that really matching up with. And that's very difficult even for professionals to do, to interpret that research. So I always think it's good to go back to dietary guidelines that you trust, that are from organizations that have reviewed the research, that are putting out things that are the most recent. But back to your primary question, I would work with a patient individually on that. If that's something they're interested in, then certainly we can work on whether they're vegetarian, whether they're vegan, whether they enjoy animal products and still want to have those in their diet. We can work with that. There's no one size fits all, but there's always new things that we can look at to try to help tweak a diet to make it more appropriate for that individual.
Yeah.
And I'm not an all or nothing.
Yeah.
I'm about, let's find what's going to fit into your lifestyle, what meets your goals, both health-wise and otherwise. We want people to enjoy their life.
Agreed.
So,
I appreciate you saying that. I'm sure some patients maybe get worried when sitting down with both of you that maybe they think you're going to sit there and say, this is what you're going to do, and this is how you have to do it. And you have to eat like this. So I appreciate you all saying that it's.
Yeah, it starts with the person.
Yeah.
And we try to build the best health we can with their desires and preferences and inform them. So it's what I call an informed decision. So they can know those things.
They have choices. They're really the captain of the ship, in my opinion. I'm here to give information and let them know what's out there, what might be helpful, what we're thinking is, what the research is showing. But it's, we need to give them the good information and let them, as Dana said, make an informed decision.
Yeah.
Right.
And sometimes the time of life depends things. Like when I was pregnant, I ate more protein, animal protein, than when I wasn't. So sometimes it's you also look at your situation. There's different times your body has different needs.
Yeah. That kind of takes us into another question that we received here in the chat. This person said, dietitians are such a valued resource, smiley face.
Wow.
This person said, I was diagnosed with gestational diabetes while pregnant with my daughter, who is now 23. How much of a concern is developing diabetes as I age? My doctor referred me to a dietitian who opened my eyes to how to properly manage my nutrition needs and insulin levels during a critical time during my pregnancy. They also said nutrition is such a valuable part of maintaining our health. So their question is, because they had gestational diabetes, does that increase their risk of developing diabetes later in life?
It does, and Dana, if you want to hop in, I didn't mean to hop in front of you, but yes, there is an increased risk of type 2 diabetes once someone has had gestational diabetes. Is that like a sure thing? No. Certainly being aware of your health, eating a good, well-balanced diet with appropriate amounts of carbohydrate, addressing, any insulin resistance that might be going on. That's very important. And it's not just carbs, it's other things too, like fiber and, exercise, making sure that you're just following an overall healthy lifestyle is going to help reduce your risk the most. But because someone has gestational diabetes, statistically, they are at greater risk. And Dana, you may have the exact numbers. I don't.
Yeah.
Off of my head.
Really, the risk is pretty much associated with weight gain. So if you think about pregnancy, during pregnancy, that the weight gain of pregnancy, if you were to gain weight again like that, then you likely would again. So in some ways, your diabetes is in remission once you deliver that baby. So it's a very high association. And one of the things I like that you said, which we focused so far quite a bit on nutrition, but exercise and how important it is to make even small behavior changes, like adding a 10-minute walk after your meals,
Mhm.
making your larger meal at midday, eating lighter in the evening. So some of it is not a matter, it's a small change, not a matter of flipping over everything and becoming a marathoner, but
Yeah.
if you because insulin resistance, and we've talked about this talk is primarily type 2 diabetes, but because of insulin resistance, walking after a meal can make a big shift for a person and lower your insulin.
Yeah. Very neat. Okay. We have 10 minutes left. We still have a few other questions to answer in the chat, so we'll
Okay.
make sure we get to all of them. We're going to jump back to GLP-1s. This person said, what are your opinions on the GLP-1 patches that you see on social media? I have actually not seen this. Have you all seen this?
Yes.
Patches, GLP-1 patches?
Yes. Just no. I don't know.
No. Okay.
Just no. My opinion, is no.
Yeah,
Um,
that's not going to work the
it's
same.
Are
it's
they
just
are they prescribed by a doctor or
no.
That I'm aware of,
And
no.
they're ones that are like drops and things. No, I mean these are playing on people's, they've heard about it. They might not even qualify to get it, so they're afraid of needles or other things. There's other medications we can use, such as SGLT2s or DPP4, other classes of medications if people are afraid of needles. So just no.
Okay. No. Everyone listening, no.
No.
Right. And there are some GLP-1s in the works that are oral. I mean, and we do have
There is one. Yes,
there
there
is
is.
one that's on the market, Rybelsus.
Rybelsus.
Yeah.
That's
And
true.
then there are a couple that are, I think, in clinical trials right now. So I think there'll be more options in the future for people who don't want to take
Yeah.
injections.
And the DPP4 is essentially an SGLT, or it's essentially a GLP-1. It's less effective for weight loss. The reason people love the GLP-1 is because of the weight loss that comes along with it. But if you're just looking at your blood glucose, you can treat that blood glucose with other values. But remember, diabetes is a vascular condition. It's a metabolic cardiometabolic condition. So we don't just care about blood glucose numbers. We care about your heart, your circulation, your nerves, and it's not just about weight either, because weight is associated with cardiovascular risk, but we don't really know, we know blood pressure, there's an association, but that's different than a causality. So these things are very complicated. And when you see someone like April or myself or your physician, we're concerned about your whole health, your whole picture, not just a single symptom. Most people are concerned about their weight as a symptom. You might, when you have diabetes, some people focus in on their blood glucose numbers, but we really want to look at your whole health as a whole and all those other issues.
Yeah. Okay. We've got a few minutes. One more question that's in the chat. And if anyone has any question, you got to do it quick and put it in here. Someone said, what are your thoughts on someone who doesn't need to lose weight going on Ozempic? And I feel like I see this a lot. Yeah. What are your thoughts on that? I guess that doesn't necessarily maybe relate to diabetes, but
Yeah, well, so there's a couple things. The public seems to be upset that people without diabetes are taking GLP-1s. I don't have a problem with that if they, and that has changed now in the past, now there's an indication for obesity, and I think that's appropriate because it can prevent diabetes. This person specifically asking about someone who doesn't need to lose weight, and I don't know what they mean by doesn't need to. But I can't think of any physician who would give someone who's at a normal weight a GLP-1. We have specific guidelines as to what a BMI is. The real problem is we're accustomed to seeing people with a high BMI as normal weight. And so we might think, oh, that person doesn't need to lose weight. Well, they actually might for a health reason. I'm not talking about the celebrities. I don't know anything about their life. They might need to lose weight to get a certain role. I don't know. It might be, if you think about it, what does it mean to need to lose weight?
Right. I guess it varies from person to person.
They might have to lose weight to keep their career. I don't know. I'm thankful I'm not in that kind of career.
Yeah. Agreed. We've got one more question here. This person said, my friend Christy is a type 1 diabetic. When I spend time with her, what is the best snack to have on hand if her blood sugar drops?
Well, I think, first of all, her friend probably needs to plan ahead and have something with her all the time, whether she's with someone else or not, because the low blood sugar can happen, anytime, and you want to be able to treat it. But I always recommend something that's got some fast acting carbohydrate in it so that it gets in there quickly and raises the blood sugar. And it only takes about 15 grams. So, and hopefully her friend knows this, but, if you've got a meter, it's good to go ahead and check it and see what it actually is. Then treat it with about 15 grams of carbohydrate. They make glucose tabs that work really well for that. That's probably the easiest thing to use, and they're over the counter. Of course, now Dana may have a better recommendation for that in terms of, keeping glucose tabs or whatever. You could use, if you didn't have anything else, use some, little hard candies or something that's going to get in there quick, or something. I don't know what might be the most appropriate for someone to carry around with them. But I always recommend something that gets in there quick, a piece of candy or something. But you have to be careful because people can kind of get panicky when their blood sugar drops, and then they can tend to overeat, and then it'll raise it too high later. So the idea is you take in about 15 grams of carbohydrate, you wait about 15 minutes, check your blood sugar again, see if it's starting to go up. Once it's over 80, it's usually, getting back into that normal range. And then they need to go have some protein in a meal when it's mealtime. But so, fruit, juice, something like that. Dana, chime in about what you think.
Well, the main thing is, if the blood sugar's low, don't give them anything with fat in it, because that's too slow. That will slow down the response. So, and I would also say prevent the low. Just, if you're going to be doing something physically active, that person probably needs a little less insulin than they usually have with the meal. So this is where working with a diabetes educator could really help your friend to never have a low when she's with you. So we can make a plan for that. So thank you for asking that question and for being such a concerned and great friend. And I would suggest just the tablets are the best because they're small, easily portable.
Yeah.
And if her friend is having hypoglycemia on a regular basis, that's a concern. That she really needs to talk with her provider about, because you can develop other issues from low blood sugars happening on a regular basis. But good to be aware and prepared.
I'd love to see your friend.
Yeah. Your friend to go see
your
Dana,
friend to be my friend.
Okay, ladies. Well, we only have 1 minute left. Do you have anything else that you would like to add before we end this health talk? You want to do one more final plug? Yes.
Yes, right.
Dana?
Talk to your physician. There's 4 times when it's really appropriate to see someone for diabetes education and support. Because remember, you may know what to do, but if you're not doing what you know, you need support. And we're here to support you in that process. That's when you're first diagnosed, when you have a change in your medication, when something about your life situation changes or your blood sugar, your A1C starts to head in a direction that isn't healthy for you. So those are 4 great times to be seen by a diabetes expert in our clinic, and that's when you can request that from your physician. We'd love to help you and support you in living better with diabetes.
Thank you. I am going to share my screen really quick. This is the phone number for reaching our diabetes program to be able to reach Dana or April.
Actually,
You can also scan this QR code. And you're welcome to reach out to me, and I'm happy to connect you with April or Dana. But
let me clarify something, Maddie, because I think it's confusing for people sometimes.
yeah.
Dana is at the Wellness Center. I'm located at Watauga Medical Center. So,
Okay.
and it's 2 separate referrals. So they would need a physician referral for Dana and one for me. Or we also have another dietitian, Allie Collins, who sees our patients, and she's excellent and works hard to help them as well. And we do have appointments available at both Watauga Medical Center and Cannon Hospital.
Okay.
So it's a little bit separate. We certainly complement each other, but yeah. And if they would, our telephone number in the dietitian's office is 828-262-4158. And there is also a referral form available on the UNC Health Appalachian website. So you can go on there and search for nutrition or medical nutrition therapy, and that referral form will come up if their doctor is not part of our ARMA system. If their physician is part of our system, then they can make the referral through Epic.
Epic. Okay.
Right.
Thank you, April. Will you say that phone number one more time?
Mhm.
And just to clarify, for those listening, April and Dana, while they work closely together, they are at 2 different locations. The phone number on the screen is for Dana at the Broyhill Wellness Center for our diabetes program. And April, I'm going to let you say your number one more time.
Okay. The clinical nutrition office is 828-262-4158. And I see Dr. Trait's question. From a nutrition standpoint, we see patients for all kinds of diagnoses. So it doesn't have to be just diabetes. It could be whatever. The only thing that we don't tend to do is work with people with eating disorders, because I really am a proponent of going to a dietitian who specializes in that. And we don't have anyone at this time that does that, but there are other professionals in the area, or infants who have like tube feedings and stuff. We don't do that, but most everything else we work with.
And in the diabetes clinic, we work to get people set up with their CGM, to get type 1 diabetes, type 2 diabetes, gestational diabetes, anything diabetes, all things diabetes we address.
Great. Thank you, ladies, so much. Dr. Trait just chimed in. She said, thank you so much for today's webinar. You both did so great. I really, really appreciate you taking the time to do this. We will share this on our YouTube channel. It will be on our website. So if anyone listening right now, they had a loved one that they really want to hear this, it will be available in the future. And thank you. I can't thank you both enough. I had so much fun with you today.
Thanks to everyone who hopped on, and thanks to you, Maddie and Dana.
Thank you, April.
Thank you both. Have a great
Bye-bye.
rest of your day. Bye.